Hello, this is Heather Christensen, your professor, and I will be narrating our slides about birth and the newborn infant. Some of the events that happen just before birth include the head of the fetus settling into the pelvis. This is often called dropping or lightening, and we always hope that the baby will be face down or head down, because if the baby is coming out breech, which would be feet first, then that poses the risk of oxygen deprivation. If baby comes out head first, then obviously they can breathe more quickly than if their feet are coming out first. Some women may experience what's called Braxton Hicks contractions, and these are the first uterine contractions or false labor contractions. Some women feel them as early as 6 months into their pregnancy. And what is happening here is the toning of the muscles in the uterine area, preparing the woman for childbirth. Some women experience pelvic pressure or even the loss of their mucus plug. The mucus plug is the plug that covers the opening of the cervix and basically protects baby from the outside world while the woman is pregnant. So once the plug releases, then that is an indicator that birth is nearby. Also, some women may experience their amniotic sac breaking. Sometimes it happens naturally, not as often as we see in the movies, but most likely the doctor will have to break the amniotic sac for the mother. So when it's time, some of the signs of labor that a woman might experience would be indigestion, diarrhea, backache, or even abdominal cramping. So now mom has gone into labor and she is entering her first stage of childbirth, and this typically is the longest stage. Can last anywhere from a few hours to a few days. During this time, the uterine begins to efface or thin out, and also the cervix is dilating. And we need the cervix to extend to the size of 10 centimeters or 4 inches. On the right-hand side, you can see the visual guide I've given you. That 2 centimeters would be the equivalency of the circumference of a penny, and we need her to get to the size of a bagel. So dilation of the cervix is what is most responsible for the pain that a woman feels during childbirth. During this time, they are doing fetal monitoring. So they are monitoring the baby's heartbeat as well as the frequency and the strength of the mother's contractions. When the baby begins to move into the vagina or birth canal, this is known as transition. And now mom will move into. So now mother has entered the second stage of childbirth, and this is when baby appears in the opening of the vagina or the birth canal. The second stage is not as long as the first stage, and now once baby's head is crowning, it only takes about a few minutes for baby to be born. Here's a visual for you. On the left-hand side, we are still in stage 2, and you can see the baby's head crowning here, and the baby will emerge from mother's body. After baby emerges from mother's body, we have to go into what's called the placental stage, and that is where mother will have to birth the placenta. Here is a baby that has been birthed in what's called a water birth. Some women find it much more relaxing to birth in the water. As you can see, this particular baby is still inside their amniotic sac. Typically, this amniotic sac breaks prior to birth, but when it does not, then it will need to be broken so baby can emerge and take its first breath of air. Our third and final stage of childbirth is called the placental stage. And this is where the placenta has to separate from the uterine wall and will be expelled through the birth canal with the fetal membranes or the amniotic sac. There are various methods of childbirth. One of them includes anesthesia. Anesthesia is not used very often, but when it is, it's typically because something traumatic has happened. Say the mother's been in a car accident and they need to get the baby out of the body quickly, and mother is unable to go through the birthing process. So the reasons they don't like to use this method any longer is because there are effects that happen to baby. Baby oftentimes will be lethargic or have a hard time breathing. Another method would be using local anesthetics, like the epidural. Here's an example of an epidural tray. And as you can see, this tubing that's right here, that tubing would be placed in the base of the mother's back, and it would go into the epidural area of the spine. Medication would be administered to numb her from the waist down during the childbirth process. Another example would be vaginal birth. As you can see this image here, baby's being born vaginally. You can see the umbilical cord wrapped across baby's face. Doesn't seem to be posing an issue. If that particular cord had been around baby's neck, they may clamp and sever the cord prior to baby emerging fully from mother's body, primarily because they don't want baby to be deprived of oxygen. So during vaginal birth, many women will choose to do the epidural, like I mentioned in our last slide, where it numbs them from the waist down. Other mothers choose to go through what's natural birth, and that would be with no medications, just using self-calming techniques, meditation, similar to Lamaze. With Lamaze, typically you have a partner or a support that helps you through the process of birthing. Another method of birth would be the C-section, or sometimes called cesarean section. And this is where baby is born surgically. A 6-inch cut is made in the mother's lower abdomen and through her uterus to expel baby from the body. Typically this is done if vaginal delivery is risky for mother or for baby. Once baby is born, they will clamp the umbilical cord, which you can see here, and they will sever that umbilical cord. Many times, doctors will wait for the umbilical cord to stop pulsating. Once it stops pulsating, then that tells us that the placenta is no longer working and giving oxygen to baby through the umbilical cord. Once baby is born, oftentimes various tests are performed. One of them may be the Apgar scale. So basically the Apgar scale is assessing the health of the neonate or the newborn baby. It's based on 5 signs of health, and the neonate can receive a score of 0 to 2 on each level of the scoring scale. The first thing they look at is the child's general appearance or color. If baby does not have very good color, then they might get a 0 or a 1. If they have nice color, pink skin, they will get a 2. They look at the pulse or heart rate. They look at the grimace, which would be coughing, sneezing. They look at the general activity level or muscle tone of baby. And they also look at the respiratory effort, the rate of breathing. This particular scale is administered 1 minute after birth and then again at 5 minutes after birth. Another assessment scale used is the Brazelton Neonatal Behavioral Assessment Scale. This is based off of 4 areas of behavior. It measures reflexes, motor behavior, muscle tone, and response to stress. Typically, this test is given between the ages of birth to 2 months of age. And Dr. Brazelton has told us that the scale gives us the chance to see what the baby's behavior will tell us. It gives us a window into what what it will take to nurture the baby. Basically, the premises of the scale is that babies are born ready to communicate. And they may not use words, but their body movements, cries, and visual responses are their way of speaking. Sometimes we run into what's considered birthing problems. One of the birthing problems that may occur would be oxygen deprivation, sometimes called anoxia or hypoxia. Prenatal oxygen deprivation can impair the development of the child's central nervous system. It can cause cognitive and motor problems and psychological disorders. If the baby has oxygen deprivation at birth, they may have learning or memory problems. It can cause health problems such as the onset of schizophrenia and cerebral palsy. Some of the causes of oxygen deprivation would be maternal disorders, immature respiratory system if baby cannot breathe properly when born, if they have prolonged or constriction of the umbilical cord during birth. So I mentioned in the previous slide, during the vaginal birth slide, if that cord had been wrapped around baby's neck, that could be constricting oxygen flow to baby. If baby is in breech position, so if baby is being born feet first, that can pose an issue of oxygen deprivation. What are some of the risks connected with being born prematurely or low birth weight? First of all, a premature or preterm baby would be considered a baby born before 37 weeks gestation. The normal gestation period is 40 weeks. Low birth weight babies are considered babies born less than 5.5 pounds. Small for date babies would be babies born a low birth weight, although they are full term. There are some risks connected with being born prematurely or low birth weight. There's infant mortality. So there's some statistics that tell us that neonates weighing 3.25 pounds to 5.5 pounds are 7 times more likely to die than infants born of a normal birth weight. Those babies weighing less than 3.3 pounds are nearly 100 times as likely to die. Many times they might experience delayed neurological development. The lower birth weight may pose poor performance throughout school years. They may have delayed motor development, such as walking. And what we do know is that preschool experiences can foster cognitive and social development for many of these children. So postpartum period, this would be the period after baby is born, and oftentimes women might experience a change in their mood. That might be called the baby blues, and it's normal for many women to experience. Their hormones are going back to normal from being pregnant, and it usually doesn't really impair the mother's functioning. She still can care for her baby and go about her daily routine. Many women might experience what's called postpartum depression, and this is present in as many as 1 in 5 to 10 women. And it begins about 1 month after birth and may linger for weeks or months. Something more serious might be a major depressive disorder with postpartum onset. It may involve psychotic features in 1 in about 500 to 1,000 women.